This new coronavirus causes respiratory tract infections, and that can result in symptoms like fever, cough, and shortness of breath. It came from the Hubei province of China, and what makes it unique is that sometimes an animal can pass its coronavirus, like a camel, cats, cattle, bats. They can pass their coronavirus onto a human, which can then spread to other people. This situation is very similar to the SARS outbreak in 2003, which was severe acute respiratory syndrome, and also similar to the MERS outbreak in 2012, which was the Middle East respiratory syndrome. The virus spreads through person-to-person contact from respiratory droplets, typically through coughing or sneezing, especially if you're within 6 feet of each other. The CDC put out some tips on prevention. One is wash your hands with soap and water for at least 20 seconds. And if you can't do that and you're using an alcohol-based solution, make sure that solution is at least 60% alcohol. Second, avoid touching your eyes, nose, or mouth. Third, if you're sick, stay home. Next, if you have to cough or sneeze, make sure you do it into a tissue and then throw that tissue in the trash. And lastly, make sure you clean or disinfect any frequently touched objects or surfaces, like a doorknob for instance. If you want to know what your risk of contracting the virus is here in the United States, the CDC has posted some recent numbers as of February 3rd, 2020. It shows the results of some patients under investigation. 11 of them have tested positive, 167 have tested negative, and 82 tests are pending. There's an ongoing risk assessment as to how deadly this virus is going to be. We don't really know yet, but the closest parallel we can draw is to the SARS outbreak, for which the death toll was in the hundreds. But just to give you guys some perspective, the flu can kill up to 61,000 Americans per year in a bad year.